Welcome to the deep dive. We take a whole stack of sources, break them down, and pull out the key insights for you.
That's the goal.
Today, we're getting into a really interesting bit of medical history. We're looking at homeopathic remedies.
Yeah, specifically we're using William Boericke's Homeopathic Materia Medica as our main source. It's a classic text.
Right. And we're focusing on just one remedy mentioned there, Cerium Oxalicum. Now, for anyone maybe less familiar, a Materia Medica, it's basically like a big encyclopedia, right? Listing out remedies, what they do, when to use them.
Exactly, a comprehensive guide. And our sort of mission today is to unpack Cerium Oxalicum. You know, what is it? What was it used for? How did it stack up against other things back then?
Okay, let's get into it.
So what's always fascinating in these old texts is how they pinpoint a remedy's use. Cerium Oxalicum, which is also called oxalative cerium, it's presented as having this really defined sphere of action.
Sphere of action. I like that phrase. It sounds, I don't know, quite targeted. What does that actually mean, though, in like the context of these books?
Yeah, it's a core concept. So in a homeopathic materia medica, the sphere of action basically outlines the specific systems or organs or maybe symptom patterns that a remedy is thought to affect. It's like its designated therapeutic zone.
If boundaries.
Precisely. And for Cerium Oxalicum, Boericke gets straight to it. He mentions spasmodic reflex vomiting and spasmodic cough.
Ah, spasmodic. That word seems pretty important then.
It really defines its main area, yeah.
Okay, so spasmodic,
Yeah.
that implies something involuntary, right? Like sudden, maybe intense muscle contraction.
Exactly.
So for vomiting and coughing, the remedy was suggested when those things were driven by that kind of reflex, often quite violent.
That's the idea. It wasn't just any cough or any vomiting. It was specifically that that quality of the symptom that they were matching it to.
That specificity is interesting.
It is, and it gets even more specific. It notes vomiting of pregnancy and also of half-digested food.
Okay, vomiting of pregnancy. Given that really strong focus on spasmodic reflex vomiting, how does morning sickness, fit in? Does it always feel spasmodic, or is this maybe where the remedy's use broadens out a bit?
That's a really good question. While we might not always think of morning sickness as like overtly spasmodic today, in this context, it likely pointed towards that kind of persistent, really hard to manage nausea and vomiting.
The kind that feels relentless.
Yeah, potentially reflex driven in their view. It's also interesting it mentions whooping cough with vomiting and hemorrhage.
Whooping cough with vomiting and hemorrhage. Wow, that sounds incredibly serious.
It does.
I mean, was that a common thing to see back then? And what did that imply for the patient if they were trying these remedies for symptoms that extreme?
Well, it certainly shows the remedy was being considered for really acute, potentially, life-threatening conditions, things that were sadly common then. That combination, the violent cough, the vomiting, the bleeding, it really underscores the intensity of what doctors were dealing with. It's a stark reminder, really, of medicine before all our modern tools.
Yeah, you forget sometimes.
These symptoms were just reality for practitioners. And even getting a small bit of relief would have been huge for the patient's comfort, maybe even their survival.
Makes sense. And then it sort of shifts gears a bit. It also lists dysmenorrhea in fleshy, robust women and notes it's better when flow is established. So this suggests it wasn't just about the stomach or lungs. It had gynecological uses too.
It does broaden things out, to gynecological issues. But you still see that kind of underlying theme of pain or discomfort that gets better once a natural process gets going.
Like the period starting relieves the pain.
Exactly. And mentioning fleshy, robust women, that's classic homeopathy. The patient's constitution, their build, and these specific modifying factors like, is the symptom better or worse under certain conditions? Those details were absolutely crucial for finding the right remedy match.
It shows a very individualized approach, doesn't it? Looking at the whole person and the specifics.
Truly holistic for its time, yes.
So beyond Cerium Oxalicum itself, the source mentions some relationships, comparisons with other remedies. That's always helpful for context.
Definitely. It helps place it.
The first one is Inglevin, described as made from gizzard of a fowl.
The gizzard of a fowl. You have to admire the sheer resourcefulness, maybe, finding potential remedies in places like that back then.
Yeah, quite something.
It really highlights how diverse and often quite empirical the approaches were. So Inglevin is also noted for vomiting of pregnancy, gastric neurasthenia, infantile vomiting, and diarrhea.
Okay, so Inglevin seems to cover a wider range of vomiting then. including nerve-related issues or problems in infants, whereas Cerium oxalicum was more for that specific spasmodic type.
That seems to be the distinction, yes.
What exactly was gastric neurasthenia back then? It sounds a bit archaic.
It does. Gastric neurasthenia generally referred to stomach problems that they thought were caused by sort of weakness in the nervous system, nerve-related stomach trouble, essentially.
Got it.
So this comparison is useful because it shows that different remedies, like Cerium oxalicum and Inglovin, were aiming at similar problems, vomiting, even though their origins and maybe their full range of uses were different.
Right, understanding the alternatives they considered.
And the source also just briefly lists amygdal, lactic ac, and ipecac as comparisons.
Okay, those are other known homeopathic remedies. It doesn't go into detail here, but just mentioning them implies they probably shared some symptoms with Cerium oxalicum, right? Offering other options depending on the patient's exact picture.
Exactly. It encourages that careful differentiation, trying to find the most precise match.
Always looking for that best fit.
And finally, the dosage. It just says first trituration.
Okay, and for listeners, trituration, that's a specific preparation method in homeopathy, isn't it?
Yeah.
Grinding the substance really finely with something neutral like lactose.
That's right. In a specific ratio, usually 1:9 or 1:99 for the first C or X potencies, though here, first trituration likely means the 1X or maybe 1C preparation. It involves grinding and scraping.
Okay, so if we kind of pull all this together,
Yeah.
what does Cerium oxalicum, as described here, really tell us about homeopathic practice back then?
Well, I think Cerium oxalicum, with its really precise notes about spasmodic reflex vomiting and these quite severe conditions like whooping cough with hemorrhage, it perfectly illustrates that core homeopathic idea of similibus curantur.
Like cures like.
Exactly. It wasn't just about treating a symptom like vomiting, but the very specific quality and manifestation of that symptom, the spasmodic nature, the triggers, the accompanying factors.
Yeah, detailed matching.
Yes. And what's really striking is that this kind of intense symptom matching was seen as, well, the cutting edge of personalized medicine in its day, long before our modern diagnostic tests. It gives you a unique window into how they approached patients and thought about treatments back then.
It really is fascinating how carefully they observed and cataloged everything. But, it does make you wonder, without our modern ways of testing things, what was the actual basis for making those connections? How did they establish that this specific symptom pattern linked to this specific remedy?
That's the big question, isn't it? The methodology was largely based on provings, giving the substance to healthy volunteers, and meticulously recording the symptoms produced, and then clinical observation over time, matching the proving symptoms to the patient's symptoms.
So observation and pattern matching, fundamentally, it really makes you think about how much the whole process of gathering and using medical knowledge has changed. Quite a journey into a specific corner of medical history.